for watching Conversations with Betty Lamar. Be sure to subscribe to Betty's YouTube channel Betty Lamar Memphis for more great shows. Now, back to Conversations with Betty Lamar, already in progress.
Hello and welcome to On Cable Tonight. This is the special edition of Medical Talk, where we keep it plain and simple. I always start out by thanking you all for tuning in and just being so devoted to the show. And today, our topic of discussion is sickle cell anemia. So many of you all out there, you know, you come to me and you say, Betty, what do you talk about sickle cell? Because that's something that doesn't get a lot of airtime like other diseases out there. So I have with me one of the masters this evening that's going to speak with us about sickle cell anemia. And his name is Mr. Mark Yancy, and he's the manager of operations for Methodist Healthcare's Comprehensive Sickle Cell Center. Good evening, Mr. Yancy. How are you?
I'm doing well. It's a beautiful day. Thank you for having me on.
Oh, I'm so happy that you're here. You know, you come highly recommended.
Oh, well, thank you for that as well.
Surely, as soon as I said, I want to do a show about sickle cell before somebody body slammed me about it, because it's like, Betty, you can do what you want to do. Mm-hmm. So we're sickle cell, you know, and especially in our community. So let's do this first. I would like for you to just tell our viewers what they need to know about Mark Yancy as it relates to what you do with Methodist Comprehensive Sickle Cell Center.
Well, first of all, it's good to be here on a program that is intended for Memphians. I'm a lifelong Memphian. It doesn't get more Memphis than me. I was product of Memphis City Schools, got both of my degrees from the University of Memphis, so anything that can help our fellow citizens and my fellow brothers and sisters, I'm all for it, so thank you for having me here. My title is a manager of clinical and business operations for Methodist Comprehensive Sickle Cell Center. I've worked at Methodist since 2006, and the bulk of my time has been either planning to put something in place to serve sickle cell patients, or either running the place that we put together to serve sickle cell patients. Okay,
well, let me ask you this. We're going to go into, I always say, classes now in session.
Okay.
Because I treat this like a class, medical class. I'm going to tell you this. This is how I sort of got into this, happened into this. I remember before I was and there was a couple of doctors, 2 or 3 doctors, that was talking, you know, about stuff.
Right.
I didn't understand anything. So I feel like my spirit said, you know what? That's what you need to do. You need to do a show and keep it plain and simple, because you're going to be on the plain and simple side, and then you'll have people that can talk also plain and simple to the people like yourself that really want to learn.
That's right.
And I have a lot of older people and senior citizens that watch this show religiously, because as we get older, Mr. Yancy, we tend to care more about our health and wellness. When you're young, you're invincible, right?
That's exactly right.
So you think. Yeah. Okay, so let's start off with, tell us about Methodist Comprehensive Sickle Cell Center, and then we're going to go into what is sickle cell.
Well, those two questions are related, but what we basically do is for adults that have sickle cell, we are their medical home. Medical home model, which simply means that they get all of their care from us. So the most important thing in this was to make sure that they had ongoing preventive and primary care, because, and I'm sure we'll get into this later, most people are aware of sickle cell by having a crisis or having this pain that throws them into these events that have to be treated through the ER. Any ER is equipped to treat that, but the issue with that is oftentimes there's not preventive care that is alongside the same track as that acute care, and then you have patients that unfortunately only come to a healthcare facility when that happens, instead of coming to a place to try to prevent it from happening. So the center itself makes sure that if a patient goes into a crisis, they can be seen that day, but even more importantly, it makes sure that all their care is taken care of on an ongoing basis, whether that's a strep throat, a cold, or something sickle cell related.
So how common is the disease, and how many people in our community have been diagnosed with sickle cell?
So about 1 in 350 African Americans have sickle cell. For the purposes of our discussion here, it pretty much is solely an African American disease. So about 1 in 350, and then 1 in 350 to 1 in 400. And in Memphis, we have estimated to have about 2,500 adults with sickle cell.
Okay, well, of course, you know firsthand what it means to live with sickle cell.
I do.
When did you get your diagnosis, and how does people know? And I have some good questions for you too from some of the viewers, so we'll get into that because that does relate to the crisis.
Right.
Those are the questions.
Exactly right.
So when did you know, and how did you know?
So I'm gonna date myself and age myself with this question, but I was diagnosed at the age of 11 months. Before I was board, there was no what we call newborn screening to identify that a person either had the sickle cell trait or sickle cell. So I was born at a time when no one knew that you had it until you had some type of event or some type of presentation that said, well, this person's sick or this baby's sick, why is this happening? I had a very common experience to sickle cell infants. I had what they call hand and feet syndrome, where my hands and feet had swollen up, and I started going into pain, and that's how I was diagnosed. Now that isn't the case, though. Ever since 1986, they have newborn screening. So now, if you are born, you will be notified via a blood test that your child does have sickle cell anemia or sickle cell trait. So if you're older or were born before that time, there was something that happened to you that led them to diagnose. After that, that shouldn't happen anymore. Since 1986, it shouldn't happen anymore.
Okay, well, let me ask you this. We're going to go back now to the Comprehensive Sickle Cell Center. What makes it unique?
What makes it unique is that it was designed specifically for adults with sickle cell, no one else. So the other thing that's unique about it, we're talking about our fellow Memphians here. And what else is unique about it is that it was totally born out of a fundraising campaign. So other Memphians gave their money to make sure that this center was built. The center itself was constructed by a capital campaign that raised $1 million to design and construct the center. So one, you're not going to find another center that is really based on the generosity and passion of others to help those with the disease. So that's first. The second thing is that, when you come into the center, it's all about this patient with sickle cell, meaning no matter what is going on with them, there's no other patients there. The staff is not trained on anything but sickle cell. So it is uniquely focused to make sure that those patients are cared for, and it really is a model in which all of the expertise is there in the center, and so we bring the patient to the expertise, and in that medical home, there's nothing that can happen to that patient that we aren't prepared for.
Okay, so where is this center located?
It's located at Methodist University Hospital. It's on their campus. It's in the outpatient building, which we call the Medical Arts Complex, which is at the corner of East Moreland and Cleveland. So it's right downtown in the medical center.
Yeah, because I always wondered where it was. I knew it was there. I was so happy, when I saw the ribbon cutting, I was like, oh my God, yay, something for sickle cell patients.
Right.
But let me ask you this too. What treatments does the Comprehensive Center provide?
I get that question a lot, and there is no, newfangled anything for sickle cell treatment. It's really just a knowledge-based treatment. So, but that being said, when they come in, let's say a patient is having a sickle cell crisis, they can call at 8:30 that morning and say, I'm not feeling well, I'm having some pain. We will tell them to come in, and the typical way that you address a sickle cell crisis is two things. One, there's typically some type of form of dehydration that's going on, so that you'll have to have IV fluids administered to the patient to help relieve the crisis itself. And then for the patient itself, just from a quality of life and just to get them out of that pain perspective, they will be given pain medication to calm them down and to get them into a mode that they're not so it's not such an emergency anymore for them. So it's pain medication, hydration. We watch them. We make sure that they're doing okay. If they are not getting better and they're actually getting worse, and this is something that that may take longer than the hours that we're open, they can actually be directly admitted to the hospital, and thereby totally preventing going to the ER, which the ER is a wonderful place, but none of us want to go there unless we absolutely have to. So.
No, and then it's almost like you still have to end up going to the center. So why? I mean, that's like, to me, some waste of healthcare dollars sometime if you can make it until the next day and you all going to get them in anyway.
That's no doubt.
Okay, so let me ask you this. And then I'm going to ask you a couple of questions from some of our viewers.
Okay.
What is the connection with St. Jude?
So, St. Jude's Children's Research Hospital is just an absolute blessing to our community. They take patients from around the world for cancer. And going back to the Memphis connection that we've been speaking about, and that theme, sickle cell is one of the diseases that they've taken on, that really they treat every child in Memphis that is born with sickle cell is seen at St. Jude. Oh. So they have done an awesome job of making from birth through 18 really the best center in the country for those with sickle cell. The issue has always been, does that care continue after they turn 18? And that has a huge bearing on why we even exist. But St. Jude has done wonderful things research-wise for sickle cell. They continue to do that. And we just want to provide the back end so that there's a continuum of care from birth throughout the entire life cycle of the patient. And St. Jude has just done a wonderful job with that.
So that's good. So if you start off as an infant with sickle cell, and so that means you're basically St. Jude. Maybe it depends on what's going on. Labana, I'm sure, is somewhere in the mix.
They are.
But when you age, now you have the Methodist.
That's right.
And comprehensive center waiting on you.
That's right. And the other thing that makes us unique is we're the only clinic that has a transition clinic, a defined transition clinic that we share with St. Jude. Okay. So St. Jude comes out of the walls of St. Jude, and for the first year of any patient that transitions to us, they get to see their physician from St. Jude and their physician from Methodist for that first year from a handoff perspective, so that there's a seamless transition. And we share a case manager by the name of Sheila Anderson, who's wonderful, who coordinates that process from St. Jude to us. So she's actually at St. Jude 3 days a week and with us 2 days a week to make sure that those patients' transition is coordinated.
Sickle cell anemia is one of a group of inherited disorders known as sickle cell disease. It affects the shape of red blood cells, which carry oxygen to all parts of the body. Red blood cells are usually round and flexible, so they move easily through blood vessels. In sickle cell anemia, some red blood cells are shaped like sickles or crescent moons. These sickle cells also become rigid and sticky, which can slow or block blood flow. The current approach to treatment is to relieve pain and help prevent complications of the disease. However, newer treatments may cure people of the disease.
It's the same question, so obviously this is real important.
Okay.
It's on everybody's mind. Antoinette Chambers, she works at Labana Children's Hospital, and Miss Shirley Patton, which is my personal wardrobe stylist. She tell me what look cute on me, get that.
Let me make sure I answer her question.
Yes. Okay, they both want to know if a person has sickle cell, the trait, because that's what we're talking about, sickle cell, the trait, because we want to go into the trait.
Okay.
What triggers an episode or crisis, and what symptoms should you look for? Like if you have a child, children can't just say what's going on with them like an adult.
Right.
So what do you look for as a parent if you have a child with the trait?
So it's a very good question because this comes up all the time, as you stated. The trait really is distinct from sickle cell anemia and sickle cell disease. And it's confusing, but really the trait just means that you carry the genetic marker for sickle cell. In order for someone to be born with sickle cell, they have to have a mother and father that both have the sickle cell trait. Okay, if that child then inherits the trait gene from both the mother and father, then they have sickle cell.
Oh.
It can also say they inherit the normal side from the mother and then the trait from the father. They can just have the trait, which makes them then the same as their parents, makes them similar to that. So sickle cell trait itself is really not a big deal from a quality of life perspective.
Okay.
It simply means that you have the possibility of having a child with sickle cell. As of late, there's been a push to label the trait as a condition, but that's only because it takes rare and extreme circumstances for somebody with the trait to have any presentation of illness or sickness at all. I mean, it's very rare. You may have heard of, there have been some football players in the NBA, well, excuse me, in the NFL and the NCAA that have had some complications from overexertion that has thrown them into a sickle cell event. But that's only at the point at which someone has exerted themselves so past the point of what they should, that they've triggered that. But this is so rare that it really is just one of those things that needs to be talked about when you have an athlete that has a sickle cell trait at a certain point.
Well, as this show is like plain and simple, Mr. Yancy.
Okay, I try to make it plain and simple.
Oh, you're doing great, but I have another question for you. Because if I was sitting at home, this is what I would be wanting to know. What is an event? What is that an event? Give me a scenario, if you will. What would an event look like?
Tune in on Fridays at 9:30 p.m. on Xfinity Cable Channel 17 for Medical Talk with Betty Lamar and Laura Scott. Medical Talk is exciting and informative, featuring top doctors, medical professionals, and inspirational patient testimonials. Now, back to Medical Talk already in progress.
They want the patient to be taken care of safely and effectively as well, and you just take an empathetic approach to it and have a rational conversation with them and okay. They can be rational. Yeah.
Yeah. Okay. And this also will relate to the extreme nature of this of the extreme set of circumstances that will produce it. Everybody is familiar with the NFL and football. Mm-hmm. Well, if you were to Google the story of Ron Clark was a safety for the Pittsburgh Steelers that recently retired. He now works for ESPN as a commentator.
Okay.
And he has a sickle cell trait, had never had any issues from having a sickle cell trait whatsoever, was playing a game in Denver in altitude. Everyone knows they call it Mile High Stadium in Denver's, it's about a mile high altitude wise. And he was exerting himself so intensely in that thin air that it sent him into an event that was very similar to a sickle cell crisis. So, without making it too complex, if your viewers would probably Google Ron Clark, they'll get a very relatable story that speaks to that and even has education within it of why this happened to him, how it happened, and how extreme it is. Because let's just be honest, there's not a whole lot of people that's going to be in the NFL exerting themselves to that level in altitude. So for the most part, it's something that you should not worry about.
So when you use the word event as it relates to sickle cell, does that mean she got sick, he got sick, he didn't feel good? What does event mean?
He had basically a sickle cell crisis.
Okay.
But he has a sickle cell trait. It was an awful crisis. He had to have his spleen taken out.
So crisis really means some stuff went down.
That's right. And we'll.
Not that you had to go sit down for a few minutes.
Oh no, he had a very. he was incapacitated for quite some time.
Wow.
But that's related to sickle cell trait. For example, I give you, both my mother and father have the sickle cell trait and have never had an issue with it, and most people don't because neither one of them have been in a situation that extreme. Okay. So for those that have the sickle cell trait, and about 1 in 12 African Americans have the sickle cell trait. Again, the marker for the disease, the genetic marker, not the disease itself. You'll never have a sickle cell crisis just in normal life. You'll never have any events in normal life. Really, if you have the sickle cell trait, the only thing you really should be concerned about is the fact that you can have a child with sickle cell.
What about diet? Does that come into play at all? Do you have to, people with sickle cell, do they have to think about what they eat versus someone that does not, or is just something that you have?
Definitely make sure we cleave a line here between sickle cell on one side
and
sickle cell disease on the other,
Okay.
because to spend too much time on the trait may confuse people that certain things can happen to them. And really what I would want people to know.
And that's what I wanted to clear up, because
Right.
people I found that lately talking about this show.
Right.
Believe me, 90% of the people,
Oh,
100% of the people I spoke to don't know the difference.
Yeah, the only way that I end up talking about the trait for any extended period of time is when you got a high level athlete who is expected to play, you know, in college football or D1 football or NFL or NBA. To give you another example, there have been plenty athletes that have that, and that's the only time that you would even bring up this discussion about what the trait can do to you as far as, you know, having any symptomatic expression.
So bottom line with the trait right now, because we've convinced
Yeah.
everybody that you're okay.
You're okay. I
So-
will say this: if you're an athlete and the NCAA has passed legislation that says that there's some guidelines that you have to follow once you cross that threshold of now I am a high level athlete, there are some guidelines that they have. But other than that, unless
don't
you
worry about
are
it.
that person,
Enjoy your life.
Enjoy your life
Okay.
and just be mindful of the fact that you could meet someone else with the trait, and if you guys have a child, they should have sickle cell. That statement there is really where the trait should rest in people's minds for what it is.
Do you remember back in the days when they actually did blood testing for people that were getting married?
Yes.
And they stopped that for some reason, and I think that is something that's very important, even though people still have kids without being married. But I think that was something that when they stopped doing, to me, it didn't make a lot of sense. But
Thanks for watching Conversations with Betty Lamar. Be sure to subscribe to Betty's YouTube channel, Betty Lamar Memphis, for more great shows. Now, back to Conversations with Betty Lamar, already in progress.
But let me ask you this.
Yes.
Is there also a research component to what you all do at the center?
Yes, there is. I mentioned that, and this is back to sickle cell disease, so we've left the trait behind.
Yeah, we're through with
so
that.
going back to sickle cell anemia, sickle cell disease, which is the same thing, the terms are used interchangeably. Going back to that, you know, we raised $1 million to build a center at Methodist, and then we raised an additional $2 million for an endowment for research. And we're currently right now searching for a leading researcher to take control of that endowment, and that'll be a chaired position at UT School of Medicine. And we're searching for that person now, but we purposefully put money away for research purposes. And you know, we also are partnering with St. Jude, because you know, anyone that knows St. Jude knows that they are top of the line research. I mean, worldwide, and they do
Tremendous blessing.
tremendous blessing. They do it for sickle cell as well. And so we have partnered as a site with them for certain research priorities, and that is ongoing. And the reason why that's important is because any advance in care that you have comes through some level of research. And at this point in time, I mean, even the evidence-based standards that we use to treat sickle cell now were created out of research. So it's very important to keep that going so that you don't keep doing the same thing over and over again, and that you get better at it.
So basically, there's a lot of fundraising involved in keeping this center alive. So it will be there for those adults that leave St. Jude one day. Let me ask you this. Once you have sickle cell, you always have sickle cell, and does it really, once you have it, because you said you have it, right? Sitting there looking at you, you look wonderful.
Well, I think most people with sickle cell look wonderful.
Okay.
I think unless you catch somebody with sickle cell in a crisis, or
not managing.
Sometimes that's part of the problem, is that we've had issues where people can look at someone and say, well, you know, it's a 21-year-old kid, 17-year-old kid that walks into an ER, and they are in tremendous pain, and you know, the typical thought process is, why is someone that's 20 years old that looks just like me, that looks healthy on the outside, how could this person possibly be in that much pain?
Exactly.
And you know, it just takes education to make sure that people know that just because And thank you for saying that I look wonderful.
You
I think
do.
everybody that comes into my center looks just as wonderful as I do. And but on a bad day, any of us can look. No one wants to see how we look sick. I don't care if you're healthy or not.
That's right.
But it just so happens that, you know, because so many patients are known through that process, that there's always this distinction of, well, is this person really sick because they look great? So I'm glad you brought that up. By all means, it's a blood disease. You can't see it on the surface. Everything about it is within your body.
Okay.
And so it's important for people to know that just because they look well and that they look like you, that they don't have these issues that can manifest or that can show. By the same token, it's important to treat them as if they look well and don't have anything else, because that's how people would like to be treated.
Okay, so we know it's very prevalent in people of color.
That's right.
Why?
So this goes back to sickle cell, and this is a scientific perspective, is a reaction, a genetic reaction to malaria. It's a protection from malaria. So any part of the world in which malaria was a huge issue, there are people that had the sickle cell trait, the gene marker for it, that had a protection to malaria. And because of how bad it was in taking lives and so many people died, those that survived are those that had the sickle cell trait. And so you have a prominent amount of people that have that trait because it protected them from malaria.
Okay.
The issue comes in is that when you have these people and they meet and they both have the trait and they have a child and they give them two of those traits, now you have sickle cell anemia and sickle cell disease. So
That's right.
It just so happens that the malaria endemic portions of the world are places where there are people of color. But there are Caucasians with sickle cell. There are people in the south of France, Italians that have sickle cell because same climate, malaria was there. So there are, matter of fact, I think 3 years ago, the poster child for sickle cell was an Italian. She was white.
Okay, well, we have maybe just a couple of minutes left here. So this is important. How does one make an appointment if they feel like they need to be? Let's talk about appointment really quickly and testing. Like, just say, like, if a person I just want to be tested to know.
Okay, so the good part about it is if you're at St. Jude now, if you have a child at St. Jude and you're there now, they are going to make sure that you end up somewhere that your care is ongoing. If you are a patient that is outside of that and it's older, you can call us at 901-516-8785.
Okay.
And you can make an appointment and you can come down. We'll be happy to take you and go from there.
Okay. Yeah. Well, I would just like to say, Mr. Yancy, it has been a pleasure having you on cable tonight.
Thank you.
With me in medical class. And again, I want to thank you all for watching the show and just being faithful. And we do keep it plain and simple. Tonight, we definitely kept it plain and simple. Now you don't have to stress out. Okay, now Mr. Yancy have explained, go on with your life, live a good life, even if you have sickle cell anemia, live a good life, okay? Live a good life. And I would just like to remind you all, on the next medical talk I have with me, Dr. Robert Wagner, a bariatric surgeon with the St. Francis Weight Loss Center. We're gonna talk about that. Why does some people have to go to such extremes to lose weight? So you don't want to miss a thing. Dr. Robert Wagner. Again, I'm Betty Lamar, your host for Medical Talk. And as I always say, you are what you think you are. So as you think, so are you.
Amen.
You be blessed, and we'll see you again soon.
Thanks again for watching Medical Talk with Betty Lamar and Laura Scott. We look forward to seeing you on Fridays at 9:30 p.m. on Xfinity Channel 17, and subscribe to our YouTube channel Betty Lamar Memphis for an impressive selection of great shows.